How does focused ultrasound use sound waves to treat Parkinson's? Imagine a treatment that uses nothing more than carefully directed sound waves to help manage Parkinson's symptoms. That's what focused ultrasound does. It's a non-invasive procedure that targets specific parts of the brain with high-frequency sound waves. These sound waves are directed through the skull using advanced imaging, usually magnetic resonance imaging, to ensure precision. When multiple beams converge at the target site, they create enough heat to temporarily or permanently alter the activity of small groups of brain cells. This can help reduce symptoms like tremors, stiffness, or involuntary movements. The process is guided in real time, so doctors can see exactly where the energy is going and adjust as needed. In Parkinson's disease, certain brain areas such as the globus pallidus internus become overactive due to the loss of dopamine-producing neurons. This overactivity contributes to movement problems. Focused ultrasound can target these areas to calm their activity, helping to improve motor symptoms. It is often used for patients who still have significant movement issues despite medication, or who are not candidates for more invasive surgeries like deep brain stimulation. The procedure is performed while the patient is awake, which is different from traditional surgery. It usually takes place in an outpatient setting, with no need for general anesthesia. The doctor guides the ultrasound beams precisely at the targeted brain region. Sometimes, treatment is done on one side of the brain to improve symptoms on the opposite side of the body. In some cases, both sides can be treated in separate sessions. Many people experience noticeable improvements within 3 months after the procedure. These benefits can last for at least a year, but responses vary from person to person. It's important to remember that focused ultrasound is not a cure for Parkinson's. It mainly helps manage movement symptoms and does not address non-motor issues or slow disease progression. Most patients tolerate the treatment well. Mild side effects such as headache, dizziness, nausea, or temporary speech or walking difficulties can occur. Serious complications are rare but possible, depending on the area targeted and individual health factors. Because of this, careful evaluation by a healthcare professional is essential to determine if someone is a good candidate. Candidates are usually assessed based on their specific symptoms, overall health, brain anatomy, and response to medications. Not everyone with Parkinson's will benefit equally, so personalized medical advice is crucial. Researchers are also exploring new uses of focused ultrasound, such as modulating brain activity without causing damage or temporarily opening the blood-brain barrier to improve medication delivery. These are still experimental and not part of standard treatment. For those considering this option, it's important to discuss all benefits and risks with a healthcare provider. Focused ultrasound offers a promising, non-invasive way to help manage certain movement symptoms, but it's just one part of a comprehensive treatment plan. Always seek personalized advice from a medical professional to determine the best approach for your individual needs.